Hi, my name is Chris Fulkins. I'm a researcher at the New Brunswick Institute for Research, Data, and Training. And today I want to take you through a couple of posters we've presented at some recent conferences relating to our work on non traumatic spinal cord dysfunction. This work was a collaboration between researchers at NBIRDT, including myself and Dr. Sandra McGallies, as well as Dr. Colleen O'Connell, who's a physical medicine and rehabilitation physician at the St. Cassidy Center for Rehabilitation. So, this work is on non-traumatic spinal cord dysfunction. I'll just give a bit of background here. So, non-traumatic spinal cord dysfunction refers to neurological impairments. So, that could be, for example, paraplegia or tetraplegia, resulting from non-traumatic causes. So, rather than a traumatic injury causing a spinal cord dysfunction, the impairment comes from non-traumatic causes, and that could include, for example, degenerative disease, inflammation, or tumors. So, non traumatic causes are actually more prevalent than traumatic causes of spinal cord dysfunction. But in spite of this, traumatic cases are actually more frequently studied. So, there's a need for more research on non traumatic causes. One important area where research is needed is that we need to have a better understanding of the epidemiology of this condition. And this can be relevant for health system planning and evidence based policy making to support effective management of the disease. So, one way we can gain insight into this epidemiology is to study non traumatic spinal cord dysfunction at the population level. And one way we can do that is by using administrative data. So, this is routinely collected data. And in our case, we're looking at data from hospital discharges. So, previous studies from other groups have created and demonstrated the use of a validated algorithm that can actually comb through hospital discharge record to find these non traumatic cases. And this is useful because it allows us to look at the disease and what's happening at the level of the population. We can look at, for example, the prevalence of the disease, demographics of who's affected, and the hospitalization experience of the patients. So, previous studies using this approach have looked at populations in Alberta and at the national level. But our work that I'm going to talk to you about today is the first to focus specifically on populations in New Brunswick. So I'm going to just zoom out and focus on the full first poster now. So this poster was presented at the 2021 International Spinal Cord Society meeting by Dr. Colleen O'Connell, and it's focused on identifying and characterizing the condition, the non-traumatic spinal cord dysfunction in New Brunswick. So this is a retrospective study using the algorithm I alluded to look for non-traumatic cases in New Brunswick. And we're looking through hospitalization and rehabilitation discharge records through fiscal years 2003 to 2017. So we're using this administrative data algorithm. It works by looking for diagnostic codes in discharge abstracts that are relevant to identifying cases. So this is just a summary of how we went through the records and what we identified. So we looked at over 1 million hospital discharges and about 1,500 rehabilitation records. And what we're looking for here to identify cases are people who have both a diagnostic code that's indicative of neurological impairment, so for example, paraplegia or tetraplegia and a few others, and also a diagnostic code that's indicative of a known etiology of non-traumatic spinal cord dysfunction, so for example, degenerative disease. So what we do when we find this, we've identified 454 individuals who have both of these codes. We excluded 19 individuals who also had a code indicative of traumatic injury, because these cases would obviously be traumatic spinal cord injury, which is not what we're interested in here. And we excluded another 67 records where the diagnostic codes were present, but they weren't among the main reasons for hospitalization, and that's a requirement of the algorithm. So those were excluded as well. So this left us with 368 non-traumatic cases identified in New Brunswick over our 15-year study window. So now moving up here, what this translates to is a period prevalence of 61 cases per 100,000 population in New Brunswick over the study window. And we can actually compare this to results in Canada as a whole. So we can see from previous studies, there was a period prevalence identified from 2004 to 2011 of about 25 cases per 100,000. This was over an 8-year period, whereas ours was over a 15-year period. So it's not directly comparable, but if you consider the numbers, it looks like this condition is a little more prevalent in New Brunswick than it is in Canada as a whole. What we're seeing in the figure here as well is if we break down the prevalence by sex, we see that prevalence is a little higher among males than it is among females. And also breaking down by age group, we see that prevalence tends to increase with age. So here what we're looking at is the relative frequency of the neurological impairment codes. So remember I mentioned we're identifying these cases by virtue of the presence of neurologic impairment codes and etiology-related diagnostic codes in the discharge record. So here we're looking at what neurological impairment codes existed in the records among our 368 cases. So we can see that most of these cases had neurological impairment codes indicative of paraplegia. In sort of the second most common were other paralytic conditions, and this could include monoplegias, diplegia of the upper limbs, cauda equina syndrome, and then the least common condition among the cases was tetraplegia. And now over here, we're looking at the same idea, but now the relative frequency of the non-traumatic etiology codes among our cases. And what we see is that the cases resulting from degenerative etiologies are by far the most common. That accounted for about half of our cases. Followed in second place by unknown or unspecified causes. And then the third most common were inflammatory conditions or infections. So I'm going to jump over to this second poster now. I presented this poster at the 2021 University of New Brunswick Health Research Conference, and it's based on the same work I just spoke about, but here we're focusing a little more on the hospitalization experience of New Brunswickers with non-traumatic spinal cord dysfunction, so among those 368 cases. So the procedure was exactly the same, and we ended up with 368 cases. Again, here, same 368 cases. And so over here now, if we look at the hospitalization experience, first we are looking at the number of hospitalizations, so hospitalizations per person year. And what we see breaking down by age and sex group as well. So we see a total of 2,528 hospitalizations among the cases. This translates to about 0.6 hospitalizations per person year. Comparing by sex, we don't see a lot of difference in hospitalization rate between males and females. When we compare by age, we do see that hospitalizations tend to increase among older individuals. And just moving over here now. So now breaking down the age groups by sex as well. We can see that increasing hospitalization by age is maintained in both males and females, although the gradient does seem to be a bit steeper among females than it is among males. And if we look at the groups overall, young females seem to have the least number of hospitalizations, whereas the most hospitalizations tend to occur among the older female group. So here now we're looking at hospital length of stay among the cases. So in the within the bar, the line within the bars is the median, and then the extremes of the bars represent the interquartile range. And so a couple of takeaways here. So one is that there's a lot of variability in length of hospital stay between the various groups, and there's really no clear pattern of one group or another that's staying in the hospital any longer than any of the other groups. Things do look a little bit different, however, when we separate our hospitalizations by type. And so what we're doing here is we're saying, out of all the hospitalizations we've observed, some of those are related to, so when someone with a non-traumatic spinal cord dysfunction goes to the hospital, they may go to the hospital for reasons that are related to their condition, or a lot of times they may go to the hospital for reasons that are unrelated to their condition. So based on the hospital discharge records, we're dividing hospitalizations into those that were related to the non-traumatic diagnosis and those that were unrelated. And so when we do that, what we see is that when we look at the number of hospitalizations, these individuals are actually going to the hospital much more frequently for reasons unrelated to their condition. However, and we see the graph on the right, when they do end up in the hospital for reasons related to their condition, they're actually staying there for a longer period of time than when they go to the hospital for reasons unrelated to their condition. So overall, hospitalizations for non-traumatic related reasons among these cases are less common, but they are longer in duration. So that covers our two posters, so I'm going to leave it there for now. Right now, we're working on validating the algorithm that was used to generate these results. So this algorithm was previously validated based on a sample in Alberta, but it has not yet been validated on a sample in New Brunswick. So what we're going to be doing is taking the algorithm and comparing its performance to the results of chart reviews, and this is of patients, rehabilitation patients from the Stan Cassidy Center for Rehabilitation. So that's a collaborative study that's currently underway. So stay tuned for the results of that, and thanks for listening.